Hey, Dr. Derek Nielsen here, the owner of Kaizen Physical Therapy. This is my brother Corey. He's a personal trainer here in Durham. In this short video, I want to talk about why degenerative disc disease is not the cause of your back pain.
What?
This happens to be one of the things that I hear the most here in the clinic. And typically what I hear is somebody's been dealing with back pain for a while. They're usually a little bit older. Young people don't have degenerative disc disease traditionally. So they're usually somewhere between their 45s to anywhere above that. And they'll be having back pain for a while, and then they'll go in and get an X-ray or an MRI, and the doctor will come back and say, well, you've got degenerative disc disease, and that's the cause of your low back pain.
So how do they treat that?
Traditionally, it'll be some sort of injection or pain meds.
Okay.
Just something to mask the symptoms. This is for a different video, is some people will be recommended a spinal fusion. So if you're suffering from sciatica symptoms, occasionally an orthopedic surgeon will recommend that you need surgery, which is completely unnecessary as well. Mm-hmm. But that's a video for a different topic. So degenerative disc disease, what we do know and what science has shown us is that it's as common as wrinkles on the skin. Like it's just natural aging. As we age and get older, we get wrinkles on our skin. As we age and get older, the inside of our bodies age as well. And this is something that I talk about in the book here. It lays out the exact number or exact science for degenerative disc disease. So did you know people in their 20s have degenerative disc disease? In this study, 37% of them had it. As well as in the people in their 80s, 96% of people had degenerative disc disease. The funny thing about this is nobody in those studies complained of back pain.
Wow. So you're saying that I can have back pain. Let's say, okay, well, let me take it back. Let's say I take an MRI and I see degenerative disc disease, but that doesn't necessarily mean I have back pain.
Right, absolutely.
Now, can I get an MRI and not have degenerative disc disease and have back pain?
Absolutely.
So is there any correlation between degenerative disc disease and pain?
No. I guess there's a correlation because of age. As we grow older, we're more likely to have some sort of aches and pains, and as we grow older, we're more likely to have degenerative disc disease. There's the correlation.
So why are we taking these MRIs and X-rays and saying it's this that's causing the pain, and then prescribing pain medications, anti-inflammatories, injections? Why are we doing that, and what is a different method that works?
Well, that's the too deep of a question. I think a lot of it has to do with the healthcare system and insurance companies and what's reimbursed and what's not. But it's not all in all, it's not a long-term solution. An X-ray and MRI, realize that you can't see pain on an image, which is something I talk about in the book as well. But you can't see pain. So if you can't see pain, who's here to tell you that the degenerative disc disease on an image is the cause of your pain? A better way to look at it is if you have been diagnosed with that, what I would recommend you do is find somebody that looks at full body movement. Because oftentimes the area that hurts isn't even the problem. The area that hurts usually is in pain because it's overworked, because somewhere else isn't working like it should. Now, the far majority of people that I see that suffer from low back pain, it's actually a hip problem. What I mean by that is the hips aren't moving or acting the way that they should, and so the lower back has to make up that difference, and it has to work harder to take the place of somewhere else that's not working like it should.
So if my hip isn't moving correctly, then to get that movement pattern that I'm looking for, my low back ends up having to move incorrectly.
Right.
And
Correct.
has to move more and more and take more of the load and end up becoming overworked.
Right.
To the point where now I have back pain. But to fix my back pain, you got to fix the core problem, which is the hip, not the back.
Correct.
Okay.
Correct. And if somebody's had some sort of injury or a car accident or a fall, then we can start to say, okay, that was the cause of the pain. But the far majority of people who I see that suffer from pain, it's come on gradually. The pain has come on gradually. There's no exact incident that they can point to when it started. That's the person that's in pain because the area is overworked because somewhere else isn't working like it should. Mm-hmm. And they happen to have degenerative disc disease because of their age. Because they're human. Yeah, because they're human. It's so common in natural aging, and it just happens to be the thing that you can see on an MRI.
It's as common as death.
Absolutely. So again, what I would recommend you do is find somebody that can look at full body movement. Find somebody that looks at how you move all the way from your head to your ankles, and can really diagnose where the root cause of the pain is coming from, and not just treat what's on the image.